Hi, I'm Tony Willis, the Clinical Director for Diabetes for North West London, and welcome to our video demonstration on how to create the reports, templates and so on in your EMIS system for Rewind, the diabetes reducing weight with intensive dietary support program, which will support patients lose significant weight and potentially come off significant amounts of diabetes medication. So we'll talk first of all about importing the components into EMIS Web, then I'll take you through the clinical templates, the protocol, and then monitoring of patients on the program. So let's look at the importing. So I'm assuming that you have the necessary access rights to be able to import components into your EMIS Web system, and that you've downloaded these from the No Diabetes website. So we'll click on the EMIS button, as with any other sort of importing process. We'll click on reporting and population reporting, and we've created a separate folder here called Diabetes Rewind. You might want to do the same yourself, so we'll click on that, and then we will click the import button and look at the place that we've downloaded the documents to. In this case we've got an EMIS Rewind folder on our desktop. Open that, and what you'll want are the Diabetes Rewind searches monthly 1920, so click on that and that will import these into your system. Let's just move that across, hit OK, wait for it to do that, and just seeing which components are in there. So you can see there's one of them which is labelled Patient Suitable for the Rewind Program, and that's the report that will run to identify patients that we want to contact. So in addition to that, we'll also bring in via configuration and the template manager in the usual way. Again, we've created a Diabetes Rewind subfolder, and we're going to import the clinical template as we're on the Templates and Protocols tab. We'll click that and bring in Diabetes Rewind template version 1. So click open, the template will be imported. There we go. We'll click again on the document, again creating a Rewind folder, and in this case we're going to import a document which is the referral form, again version 1. So open that, and there we go. So that's all effectively done, and we'll go back to the home screen, and we can then run the searches and be able to view the clinical template and the referral form within our practice. Thank you. Okay, so we've imported the details, the searches and the clinical template and referral form into EMIS, and now we're going to go looking for a suitable population of people. We just set this up as a demo account, and you'll be running this REWES register per patient suitable for the Rewind program. In this case we've got 66 dummy patients in this test system, and we can have a look at the included population, and then you can do all the sort of things that you'd normally do as part of recall systems for QOF and so on. So you'd potentially select them, bring them potentially into your MJOG system and send them a text message. The one that we're currently recommending is this: would you like to lose weight, reduce your diabetes medications, and or put your diabetes into remission? Rewind is an exciting new program which can help you achieve your goals. Click for details, and there's a URL shortener there, Rebrandly Rewind. To be referred, please respond yes. Please note that your GP will confirm that you're suitable for this program before you're enrolled. By replying yes, you're giving us consent to share your record with ICS, the providers of the system. Of the service. So that's basically the search component of the program. So basically there's three main elements: identify patients and refer them, deprescribe their key diabetes medicines, and then monitor them particularly over the first 6 months into the program. Thank you. Okay, so we've had a chat with the patient, and a particular patient is interested in being referred to the program. In this case it's Matthew Berry, age 41, and we've had a discussion with him. We've explained a little bit about the program. He understands that there's a cost for the total diet replacement of roughly £2 per day, and so we're going to do the referral. We'll open the care record, we'll add a document. In this case we're creating a letter. Just find rewind on there. There we go. So double click on that, and in this case we've already opened it. Okay, we've got the patient document open, and you can see on there are inclusion and exclusion criteria. Just to remind you of what those are. So the patient needs to be registered with a GP practice, they're over 18, they've had diabetes for less than 12 years. So some of these components will be identified as a result of the search, but the key one: patient is able to understand or meet the demands of the treatment program. So probably best not to include people who are really frail in this, or who currently have significant mental illness. So that comes into the exclusion criteria. One of those is an HbA1c of over 85 unless they're within 6 months of diagnosis. If they're currently on insulin at the moment, severe renal impairment, currently pregnant or planning to become pregnant. We've talked about psychotic illness or very severe mental health disorders otherwise. Unwilling to provide blood samples, unwilling to allow sharing of clinical information to allow tracking of progress, and also if they're only on medications and not on DPP-4, an SGLT2 or a GLP-1. There are some additional specific exclusion criteria for the total diet replacement pathway. We'll then use the drop down. So this patient is eligible for the very low calorie diet. They would potentially be eligible for the low carb diet. We've got all of the information we need to put in, whether they're happy to be contacted by voicemail. We can put in a mobile number if needed. Can we leave a voicemail on their mobile? Do they speak English? In this case, yes. Are they on the mental health register? Let's put no for that. Are they on the learning disability register? No. The document template will automatically import key metrics, the key most recent metrics, so body mass index, height and weight, when those are measured, latest HbA1c, most recent EGFR, and so on. Then you need to just say yes, that you've explained to them the following information, that there are significant benefits and minimal risks, but there are some slight risks. If the blood pressure medication is stopped and the blood pressure rises, which is highly unlikely given what the experience of total diet replacement is, that you're responsible for close monitoring of their blood glucose and blood pressure. This can be done by phone, and that their information will be shared with ICS, the provider of the program, but also used to track progress within the whole system's integrated care record. You need to select the medication that they're on. In this case, this patient is on sitagliptin. They're not on any SGLT2s or on GLP-1s. Anything else that you want to add in there? Is the patient on any other medication we should be aware of? In this case, we can put no, and then we'll hit the file, put into the file, and save and close. And there we go. So the last bit is just to ensure that this gets emailed off to UK ICS, and we'll do that through the documents, and we'll click on that and send export document to the local desktop, let's say into this document bit, and then email it out to UK ICS using the email that is associated with them. Okay, so we now have a patient who's just been accepted onto the program. They've had their initial assessment, they've chosen to go on to the total diet replacement component, and you've now just had a conversation with them. You've been informed by ICS that they're starting and what their starting date is. So let's go into the Rewind clinical template. So we're just going to go into the care record and open data using template, and you might want to search for Rewind, but in this case it's the top of our list, so we'll just double click on that, and there we go. So we've got the Rewind template. Again, it shows some reminders of what the requirements are. You've got hyperlinks out to various internet resources. I'll just open a couple of those. There's the Rewind pathway, which is basically all of the components that a GP needs to know about managing patients on the program. So inclusion and exclusion criteria summarised there, the detail of the management, and we'll do a separate video about this. The primary care prescribing protocol, so which medications to stop, particularly amongst the diabetes meds, what not to stop, how to manage antihypertensives, the follow-up, and then also for the low carb pathway if the patient is on that, and then monitoring of blood glucose levels. So that's some quite useful information. There's also a GP information leaflet to just give you a bit more information about what the program involves, and also a patient leaflet which can be quite helpful to print off for a patient and tells them a little bit about the program. So in terms of the overall program, they get 10 group sessions, some online learning, phone calls with a health coach, and obviously the regular appointments with the GP to support the monitoring, and a bunch of frequently asked questions. So we'll just close those for the moment. The referral form gets sent to South, Central and West csu.rewind@nhs.net. ICS will notify practices about patients starting on the program. At the moment this is by email. Fairly shortly that will switch to MESH, which is the method that practices often receive information from hospitals. So we've got a patient that's starting on the program. They're starting today, so we're going to code in Rewind program commenced, and also we'll then select, it's really important we do both of these, so we'll select the type of program they're going on, so both the commencement and the type of program. In this case very low energy diet, which is total diet replacement. And that's basically all that's required at this stage to code the fact that the patient has started on the program. So we'll just save that into the clinical record. So we're now a couple of weeks, well, a week into the program, and we want to add some more monitoring information for the patient. We'll open our Rewind template, and we now want to look at the monitoring component. So this can be all done over the phone. In fact, all the discussions with patients can be done by phone, apart from getting blood at 3 months. So the patient has started. We're now into monitoring phase, and they've just told us that their home blood pressure monitor has given them a blood pressure of 130/78. We don't need to add any text at this point, and they've been testing their blood sugars, and those have been all reasonable sort of values, so we don't need to add notes to this. And we'll save that. Okay, and then the final components, so coming back at 3 and 6 months, so we'll just open up the rewind template again. The patient will have had some blood tests done as part of the review. At 3 months they'll have had an HbA1c performed, they'll have their blood pressure checked, which is 130/68, so that's dropped a bit. The height was 153, that's not changed, but their weight has dropped now down to 55 kilos, and the body mass index is now 23.5, so significant weight reduction in this case. Just some examples of the kind of changes that we're seeing in some patients. On average about 12.5 kilos at 12 weeks, so a kilo a week of weight loss fairly steadily. I've got one patient who's lost 35 kilos, who's come off 3 different diabetes medicines, is in remission, and his blood pressure has significantly improved, enabling him to come off one of his antihypertensives. So these are the key bits of information you need to put in: blood pressure, weight and body mass index, and HbA1c at 3 to 6 months. At 12 months there's the additional requirement for lipids, so cholesterol. And then finally, when the patient gets to the end of their 12 months, also you need to code the fact that their program was completed. Obviously if it wasn't completed, there's a choice there, and you'll need to code in the fact that they dropped out, that they didn't complete, and the date that that happened. Okay, so thank you for watching.